Hello and welcome to the Rogue Health Economist livecast. It is Monday, the 18th of May. This is episode 14, and I'm super excited to introduce you to this week, which is going to be all about Chronic Disease Week. We got some incredible guests later in the week. Tomorrow, I'm going to be interviewing Christy Criswell, who's one of our health advocates at Fine Functional. On Wednesday, we're going to hear from Dr. Tom O'Brien. On Thursday, we're going to talk about reversing cognitive decline with Seth Conger. And on Friday, we're going to be talking about chronic disease in context of farming and reversal of chronic disease with Sina McCulloch and Joel Salatin. They've got a new book coming out. It's going to be jam-packed. But ultimately, what I wanted to do today was to kick off and sort of lay a foundation for everything chronic disease related and everything that we think is important when thinking about it. So I'm going to share a little bit here as we get started into the starting point for Chronic Disease Week. So first and foremost, thanks to our sponsors, the Evolution of Medicine. Their virtual practice pivot guide has helped many practitioners deliver a kind of medicine that is capable of reversing chronic disease in this COVID era. So if you go to goevomed.com/pivot, you can download that guide and you can get busy with that. So thank you, Evolution of Medicine, for your sponsorship. Here's a quote for today. Behind every chronic illness is just a person trying to find their way in the world. It's Glenn Schweitzer. I love that quote. And we're going to get into some of what chronic disease is, what it isn't throughout this session. So the first thing I want to talk about is costs. And ultimately, the reason why what drew me as the Rogue Health Economist to the conversation about chronic disease was that 15 years ago, I wanted to start to really understand what was causing the costs of care to go up dramatically and realize that it's clearly chronic disease. And here's a stat: 90% of the nation's $3.5 trillion in annual healthcare expenditures are for people with chronic and mental health conditions. And we will be talking more about mental health as we go along, but really, many of the sort of factors that affect and contribute to mental health conditions are exactly the same as physical conditions. Inflammation in the brain, whole body inflammation. In 2 weeks' time, we're going to have a trauma week, and we're going to learn about the bidirectionality of information from the body to the brain and from the brain to the body. And 80% of the information that the brain is processing comes from the body. And therefore, mental health disorders can be seen to just be whole body disorders. And there's, functional psychiatry and whole body psychiatry that's looking into that. But ultimately, this is why the rubber has to hit the road with healthcare reform, with healthcare policy around chronic disease. And what can we do to reverse chronic disease? It's the driving force beyond causing cost escalation. And just to give you an idea of how things cost, I found this graph. I know it has a big typo in the middle. I didn't make it, so you just have to bear with me on that. But you can see that what does it cost the average person who has no chronic disease? Their healthcare costs about $1,100 a year, $1,200 a year, right up to, if you have more than 5 chronic conditions, the average cost is $15,954 per year. And you can see with the orange line there, that's the percentage of people in society that have those different conditions. So 50% of people have no chronic conditions and they cost a little. And then there's some people that have, let's see, 10% there have 5 or more chronic conditions and they cost $15,000, $16,000 per person. So you can see this is what we're dealing with. And this is from 2010. And since 2010, what have we seen on a meta level? People living for a shorter period of time than anyone else in human history. So if anything, these things have got worse. Certainly the costs have continued to go up because inflation in healthcare is insane. And particularly, and obviously the population has got more unhealthy. You've seen things, like the opiate crisis. You've seen things like the rise in autoimmune disease. You've seen the cost of new and expensive drugs all contribute to these numbers all going up. But this is the concept that we want to talk about, because as the Rogue Health Economist, I've been involved for the last 15 years in first understanding what drives these costs and then thinking about what is a sustainable solution to these costs. So where do these costs come from? What is the cause? If we look at what the WHO says, they'll say that the cause of chronic disease is like this. You have underlying socioeconomic, cultural, political, and environmental determinants, 100%. Globalization, urbanization, population aging. You could definitely throw into there like pollution, toxicity. We'll talk about those in a minute, but this is just sort of like the WHO definition. And one of the reasons why we've been so strong on group visits and why I wrote the book on group visits is because we believe that, you know, we can solve some of these conditions or help ameliorate some of these social determinants of health by facilitating group medical visits as the starting point of care. So these underlying issues lead to common modifiable risk factors: unhealthy diets, right? Lots of processed food, lots of junk food, physical inactivity, separation from the land. Physical inactivity is now sedentary lifestyles, working, sitting, not spending as much time outside. Tobacco use continuing to grow. There are obviously non-modifiable risk factors like age and heredity, although we did talk in the first week about transgenerational epigenetics, which is essentially that heredity, the way that your genes express. You don't start with a clean slate every time, and actually toxins go down generations. And the most obvious example that I always give is the grandchildren of people that we sprayed with Agent Orange in Vietnam. If they have birth defects 2 generations later, you know, that's happening all the way through the population, just at more subtle levels. And so you can see that although some of those are non-modifiable, there is a certain modification that is available if we're able to actually understand those root causes. Then we have these intermediate risk factors, so raised blood pressure, raised blood glucose, abnormal blood lipids, overweight and obesity, and we're going to talk about that in a minute, because this is really like the pre-phase, right? So you don't have a disease, but now you're in like this pre-phase, and we'll talk about that shortly. And then we see the main chronic diseases: heart disease, stroke, cancer, respiratory diseases, diabetes. I would also add in autoimmune disease to that. One of the reasons why autoimmune disease doesn't get the recognition is just because of the naming conventions, where they're all called different things. If we called it, if we call it digestive autoimmune disease instead of Crohn's or colitis, if we just call it all autoimmune disease, you'd see that it would be understood a little bit more clearly. But it's just because Crohn's and rheumatoid arthritis, and they all have different names, it doesn't get put into the same category. So this is the WHO. This is sort of like the main definition of what chronic disease is, where it comes from, and I agree with all of this. But in the functional medicine world, we like to go a little bit deeper into understanding some of the more, not just subtle causes, but some other causes to look at. And so there's this classic graph of the iceberg. So on the top, you see all the diseases, but then you see these underlying causes like inflammation and inflammatory imbalances, right? Inflammation is a driving factor behind all of these, chronic inflammatory conditions. And that inflammation could be caused by a number of different things in the body, the brain, your physiology that causes ongoing inflammation. And as I mentioned earlier, with mental conditions, we're now really starting to see what percentage of people with mental symptoms have just chronic full body inflammation. And it's a lot. It's enough to make us think that inflammation could be added to one of those, WHO considerations. Structural imbalances. So what structure leads to function? We know about that from functional medicine. So what about structural imbalances? And you see that lower back pain is actually the biggest cause of debilitation in the world. I saw a lecture a few years ago about just the degree to which lower back pain is experienced all across the world. Immune imbalances. And so we talked about that last week with Dr. Jeffrey Bland, how changes in the immune system and the microbiome and those kind of changes end up turning into chronic diseases, and how the immune system is really sort of like the central point for all these kind of things. Digestive, absorptive, and microbiological imbalances. Toxic emotions, anger, fear, resentment, add trauma into that, and you start to get a view into how mental, emotional things can affect chronic disease. And then on the right side, hormonal imbalances, detoxification imbalances. Toxins has been, sort of a subject that functional medicine doctors have been ridiculed about actually for 30 years, where if you talked about toxins, even to this day, people laugh about toxins. They're ha ha ha, toxins, naturopaths, they don't know what they're talking about. Well, guess what? We know exactly what those toxins are, and we know exactly how they get into our environment. And now we know exactly how they affect function. And big organizations of doctors have come out in the last couple of years. I spoke about this in my first book, just showing what chronic low-level toxicity does to function. And Dr. Bland talked about it very specifically in our interview last week, as when toxicologists were really starting to understand toxicity and poisonous doses. There wasn't really this like low-level toxicity in the environment all the time. And now that we have that, we have to think about that in the context of what causes chronic disease. There's a new understanding of mitochondrial dysfunction and how mitochondrial dysfunction leads to, a lot of chronic inflammatory conditions and toxic chemical exposure, right? You could have detoxification issues because you have a lot of exposure, or just that your detoxification pathways are not functioning at, at the height of their capacity. So this gets into, some of the causes, and ultimately what we end up with is this idea of a prephase, right? And so it's very obvious in diabetes, right? If you have hemoglobin A1C over 6.5, that's called diabetes. If it's between 6.5 and 5.7, that's pre-diabetes. And if it's under 5.7, that's normal. But the truth is, and I guess this is the thing that I want to share, is that all of these chronic diseases have a prephase. We just need to know how to measure them. And that's one of the things about functional medicine, is that functional medicine measures the gap between optimal function and where you'd be actually recognized and diagnosed with the disease. And ultimately, a lot of the frustration that people feel in healthcare is that while they're in that gap, the doctor doesn't really have any solutions, because the doctor is trained off the back of the diagnosis. Create the diagnosis, and once you have the diagnosis, then you have an optimized treatment protocol for the average person in the population. And ultimately, what functional medicine recognizes is there's this gap between optimal function and where you get the diagnosis. And in that gap, there are modifiable risk factors that, if modified, can get us back up to optimal health. And we can understand that. And that's why I believe that functional medicine is the future operating system for chronic disease, because it recognizes that gap and it actually has solutions to bring us back to optimal function. And so ultimately, when I came across functional medicine, and when I started, in all my experience seeing people reverse their chronic illness, it was about creating an urgency to start to activate on some of these, behaviors before it gets urgent. And one of the things that I'm excited about COVID, and it's not obvious that people would use that kind of language, like, what's there to be excited about? We're stuck at home, the economy is tanking, like, this is not exciting times. But what I have seen already is that there is now a realization from people that they had essentially miscalculated the risk profile of doing unhealthy things. Like, I think all of us in our mind, when we're thinking about, should I have this extra glass of wine? Should I eat this ice cream? Is it really that bad to go to McDonald's? Do I really need to exercise today? You're doing an inbuilt risk calculator. And that inbuilt risk calculator is sort of calculating, does this matter that much? Is the benefit that I'm getting from not doing it or eating McDonald's, is it actually going to catch up with me? And ultimately, for many different reasons that, it's too long to go into here, people have been making whatever choices they want on that end. Well, now you start to see when COVID disproportionately affects people with lifestyle-driven chronic disease, right? Where lifestyle-driven chronic disease is now a factor in the comorbidity of COVID or the severity of COVID, now you realize that your risk calculations were all wrong forever. Because ultimately, at this moment, if you have metabolic dysfunction, as we learned from Mike Mutzel on Friday in his conversation about immunonutrition and immunometabolism, metabolic dysfunction leads to a potential for you to have a completely different interaction with the COVID microbe. And so a lot of people now are starting to realize, hey, I need to sort this out. And the good news is, whether you listen to someone like Mike Mutzel or Dr. Bland, or very soon we'll be having Dr. Katz on this podcast, who, if you want to go and listen to, I think, the most clearly stated concept of total harm minimization, Dr. Katz on the Rich Roll podcast was super clear about total harm minimization. We're actually going to have Dr. Katz next Friday, the 29th, here on the Rogue Health Economist podcast to talk about risk stratification and total harm minimization on this podcast. So I'm super, super excited about that topic. But ultimately what's happening is people are coming to a realization that the costs of these doing unhealthy behaviors are higher than they imagined. In fact, that there are negative externalities that they didn't take into account before, and that ultimately COVID is unmasking this and are starting to think differently. And so that's why I'm excited. And I said a minute ago, excited is kind of a weird way to describe it, but I'm excited because I see that it is going to create a situation whereby which more and more people will be interested in a proactive way of taking care of their health. It's actually not completely proactive, it's kind of reactive, but you're reacting to factors that haven't yet happened. And so that's one of the things that I think, holds a lot of potential in really, will COVID be an agent of transformation? And I think that we all hope that it will. And I can see that would be an area that it might happen. So I've spoken about the costs, we've spoken about the causes, we've now spoken about the prephase. Let's talk about chronic disease reversal. And ultimately, I've been helping doctors to understand that functional medicine is the operating system of chronic disease reversal for years. If we come back to this chart, the question that we have to ask ourselves is, when does it make sense to interact? When does it make sense to deliver functional medicine into the system? And I want to share with you actually a couple of sort of anecdotes on my experience. So in 2015, I did my second Evolution of Medicine Summit. And off the back of that summit, we kicked off a project, or I helped support a project called Liberty Direct. And Liberty Direct was a simple premise. What we did is we built, Tom Blue, who built it, built a direct primary care membership or functional medicine membership on top of a chassis, which was Liberty Health Share's medical cost sharing offering. So it's a similar concept to insurance in that a community of people support you. And ultimately what we said is like, hey, functional medicine can keep people well, and investing in functional medicine causes long-term health improvements. And so let's have everyone have access to functional medicine. Makes a lot of sense. The problem is that if you have a lot of people who are in these left-hand side conditions, right? If you have no chronic conditions, or if you have one chronic condition, investing in functional medicine in the way that it's being delivered with a doctor-first approach with lots of labs and supplements, ultimately you could argue that potentially you're saving money down the road, but it's hard to make that argument from an economic point perspective, because they're only costing $1,177 per person now. A lot of those costs are really like acute costs, because guess what? People without chronic conditions, still have accidents skiing and still get hit by cars and still have, accidents on the road. And so the cost is much lower. Now, when we think about functional medicine, what it's capable of, think of like, let's say a $2,000 to $5,000 episode of care in functional medicine. Which people does it make sense, if you're an insurer, right? Which kind of people might it make sense to give that to? People with 5+ chronic conditions. If we look at the people that come in for functional medicine, like if you look at some of the data from Living Matrix as an example, we see that the average functional medicine patient has dozens of symptoms and on average 5 or more chronic conditions. So for those people, their care is already costing on average $16,000 a year. A $2,000 to $5,000 investment with a chance of getting people off those medications makes a lot of sense, right? Because ultimately it means that if you have a chance of getting people off these medications, and if you look at that $16,000, think about autoimmune disease I mentioned earlier, right? The cost of Humira is $5,000 a month, $60,000 a year. So obviously you can see even in that issue. If we put just people with an autoimmune disease on biologicals, you would see that it's a smaller part of the population, maybe 1 or 2%, but it actually makes up the cost for those people is probably over $100,000 per year if you add in all the doctor's appointments and all the other services as well as just the drugs. So there's been many smart people who have looked at functional medicine as a way to go after that big costly population of chronic disease because you've got the best chance of return on investment. But I guess I wanted to talk with all of this in the context of our other sponsor, which is Find Functional. And Find Functional is a new project that is really designed to make functional medicine much more affordable and much more accessible to the population. I want to talk about it in this context because ultimately what we see is that if you deliver functional medicine in a way that instead of having the doctor and the testing and the supplements first, but you actually start with a health advocate who costs way less than a doctor, you start with a group model at the beginning, and you start with coaching at the beginning, the costs associated with that kind of model where you have groups of people reversing their chronic illness together, that actually makes sense for a much wider swathe of the population. It might make sense for like the middle of the bell curve of chronic disease, not the most expensive people, right? And not the people who don't have any chronic conditions. These people for sure can get into it, but this middle of the bell curve who basically aren't doing the fundamentals of health, health regularly and are in the pre-phase but don't have a chronic condition yet, or maybe have 1 or 2 chronic conditions, and ultimately getting those people into groups where they can support each other to be healthy can be a transformational thing for healthcare. And that's why, as the Rogue Health Economist, this is what we made at Find Functional, is an online group called the Immune Collaborative, where groups of people can support each other to getting better. They can see how the fundamentals of health creation affect their immunity, and how then if they can improve their immune resilience, they can reduce their chances of getting one of those chronic conditions. They can then then they can reverse the chronic conditions they already have. And that is not just possible, that is happening. And I want to give another example right now. In my book, The Community Cure, earlier this year, I showcased what was happening at the Cleveland Clinic Center for Functional Medicine, which is the most exciting project in functional medicine because it's the first time that a major medical institution is showcasing the power of functional medicine. And how do they do it? What do they do at the Cleveland Clinic? What they do is they put people into cohort groups in a program called Functioning for Life. And in Functioning for Life, they take people through a journey to reverse their chronic disease in groups, in person. And the reason it works so well is that over a period of 10 weeks, you not only solve the biggest determinant that is driving chronic illness, which is loneliness. If you remember from our first graphic from the WHO, you remember that there were these social determinants of health that were driving some of these non-modifiable risk factors. So loneliness, I don't know if you've seen in society now, but with us all being, home alone, levels of alcoholism, levels of abuse, levels of drug addiction, like these things are going up because these are driven by loneliness. And the reason why loneliness is the biggest driver of all-cause mortality is because it actually stimulates unhealthy other behaviors. And it also reduces immune function. It's, we spoke about that with Dr. Bland last week. So ultimately, here are the messages, and so at the Cleveland Clinic, what they do is they put people through that 10-week program. So the first thing is they solve loneliness. But secondly, and actually probably more important, is that the community model, groups of people supporting each other to be healthy, is the way that you get big groups of population consistently to execute healthy behaviors. And I've spoken this, a ton of times here on the podcast, but ultimately we only have to look at alcoholism, right, to see that if you want to get people to change behavior and if you want to get them to get out of addictive patterns, they need support, accountability, and empowerment. They don't need drugs and doctors. And that's why we created Find Functional with a super low cost entry point, and then the Immune Collaborative as a virtual group visit for groups of people to engage with together to reverse their chronic disease in person. And we're essentially just taking the same model from the Cleveland Clinic, where in order to sort of get the right to see the doctor, we actually take you through this group program first. And ultimately, you know, that's our mission. Our mission, our North Star at Find Functional is to get people as well as possible for the least possible cost. And ultimately, you know, this is, you know, why we created that structure. So if you're interested in finding out more and you think that you'd like to learn how to reverse your chronic disease and build the muscle to start to, you know, advocate for yourself and start to shift the paradigm in your own experience from doctors having control of your health to you having control of your health. That's why we created Find Functional. You can get started for less than a copay if you go to findfunctional.com/start. So this week, we're going to have experts on and we're going to examine all parts of what we shared today. So tomorrow, we're going to get into how doctors and coaches and health advocates can work together to reverse chronic disease. Dr. Tom O'Brien on Wednesday is one of the most experienced doctors in functional medicine. We're going to talk about autoimmune disease, digestive disturbances, and we're going to talk about some of the physiology at the back of chronic illness. And then on Thursday, we're going to talk about mild cognitive impairment and Alzheimer's disease and how functional medicine has successful protocols to reverse mild cognitive impairment and how you can work with someone who's helping to do that right now. And on Friday, we're going to go deep with Sina McCulloch and Joel Salatin. We're going to talk about the full spectrum of what's needed to reverse our current trend of chronic disease from farm to table, from farm to fork, and it's going to be a great session. So really appreciate the opportunity to jam with you here today and really set up what we're going to be doing for the next week. If you have any questions, please put them in the group below. Please share this. If you found this informative or if you think there are other people that need to know this, we'd love to connect with you. And please keep watching the Rogue Health Economist. We are going to be live every day for at least the next few weeks. This week is Chronic Disease Week. Next week, we're going to talk about systemic change. The week of June 1st, we're going to be talking about trauma. And the week of June 8th, we're going to be talking about autism. It's going to be, we're really excited about all the different pieces that are coming together. Thanks so much for watching, and we'll see you next time.